Hello everyone. In this video, we are going to see a very important topic, that is heart attack. So if we go into the details of this condition, broadly it can be divided into two types based on the pathophysiology, that is NSTEMI and STEMI. NSTEMI stands for non-ST elevation MI, whereas STEMI stands for ST elevation MI. What is ST? ST is a segment that we see in the ECG that we'll be discussing further. So first of all, what is the meaning of NSTEMI and STEMI? So STEMI is a condition in which there is a mismatch between the oxygen being supplied to the heart and what is the demand of the cardiac tissue that is there. So that mismatch leads to ischemia and ultimately leads to infarction. Now, a similar pathophysiology is also seen here also. Okay, a similar pathophysiology is seen in STEMI also. So what is the difference? The main difference is in STEMI, the area of occlusion is less. So area is less. Whereas, I would say in STEMI, the area that is infarcted in the cardiac tissue is more. Okay, so if you see the pathology, if I say this is the cardiac musculature, so there is a subendocardial infarction that you're going to see, occupying only a part of the thickness of the cardiac tissue that is there. Whereas in STEMI, the entire thickness, if you see here, the entire thickness of the cardiac tissue or the cardiac musculature that is there, that is infarcted. Okay, so if you see the coronary artery that is there, the coronary artery that would be supplying blood to this part, that would having a thrombus, and that thrombus or that plaque would have ruptured and thrombosis would have occurred. So the occlusion would have increased, and ultimately the blood flow would have been disrupted. In STEMI, again the coronary artery which is supplying the blood to this part, there is a complete occlusion on this coronary artery, so no blood is flowing. Okay, no blood is flowing, and ultimately more area is infarcted. So if you see this ECG that is there, in ECG, as the name says, no ST elevation is seen. So what do you see? You see ST segment depression. ST segment depression is seen here, whereas in STEMI, ST elevation is seen. This is something that you see on ECG only. Okay, you take a ECG and you say this particular finding, and that helps us to differentiate between ST depression and elevation. The clinical presentation of NSTEMI and STEMI is mostly, to a large extent, they are very, very similar. Although I would say NSTEMI is kind of less severe condition, whereas STEMI is a much more severe condition, and many a times it is fatal. Okay. The biomarker we are going to check here is mainly TROP-I. Other than TROP-I, other biomarkers like LDH is there, AST is there. But what we check is TROP-I, and TROP-I is elevated here. Okay, it's elevated here also. But the thing is, the degree of elevation is more in STEMI. In STEMI, the degree of elevation of TROP-I, that is troponin I, that is more. Risk of death, definitely, as you can guess, in STEMI it is less, whereas in STEMI the risk of death is much more. And many a times it can be immediately fatal. I am writing here, it can be immediately fatal. You might have came across or heard of many such incidents happening in nowadays, even in the young population also. Many people not having even any of the symptoms before they are suffering a fatal MI and just dying on spot. So these things are happening nowadays, and these are mostly this STEMI that is happening to them, and they are succumbing to this particular condition. So next I would discuss this very important and very nice table that was given in this Harrison that is there. As you can see, the clinical presentation, of both NSTEMI and STEMI is similar to pain. The first thing I would say, the pain that is there. As you can see, you can have this sternal pain, a pain that is radiating to the neck area, a pain that is radiating to the neck as well as the left hemithorax, and also in severe condition a kind of pain that you can see that can be occupying the entire chest and also radiating not just to the left arm but even to the right arm also. Okay. Now the ECG, as you can see, ECG here, this is a normal ECG. Okay, it is normal. Here, as you can see, there is ST depression is seen. So I would write here ST depression is there. In this particular condition, okay, this condition ST elevation is seen here. So this is mostly a case of STEMI. Troponin. Troponin, here the troponin is normal. Okay, it's not elevated. Here mild elevation, here severe elevation is there. So you make the diagnosis ultimately in, so this particular condition, as you can see, this is NSTEMI. So in NSTEMI, you have ST depression and the cardiac biomarkers, they are mildly elevated, and that makes the diagnosis of NSTEMI. If there is ST elevation plus there is a severe elevation of the cardiac biomarkers, I can make a diagnosis of STEMI. There are other conditions also, as you can see, UA, that is unstable angina. Okay, UA stands for unstable angina. Unstable angina is also a condition similar to NSTEMI, but the cardiac biomarker that is, not elevated. That is that. These are basically grouped under ACS, that is acute coronary syndromes. Our topic of discussion as of now is NSTEMI, and how do you differentiate between these two types. And I hope you like the video. And in the next video, we would be taking some other important topics, and we would be studying them in quite a brief manner. And okay, thank you everyone.